Good morning, everyone. We're just letting folks in from the waiting room, so just give it a few more seconds and we'll get started. It looks like we have folks in from the waiting room, so welcome everyone. My name is Angela Brooks, and I am a staff member here at Healthy Aging for United Way. And I welcome you this morning. I'm dialing in from blue sky and sunshine here in Vancouver. I welcome you to our webinar, People Living with Early Stages of Dementia and Their Family and Friends in Advanced Care Planning through Community-Led Programs. I'm welcome and happy to introduce today joined today by the team from acknowledge the traditional, ancestral, and unceded territories of the First Nations of British Columbia, on which we gratefully work, play, and gather. We've just got a few housekeeping items that I'd like to go over with you all before we get started. We are all becoming very well adept to Zoom, but just as a bit of a refresher, on our webinar platform today, you will all remain muted and your cameras will remain off, everyone except for the panelists. And our back-end technical support of Aman and Maggie are here to assist us. If you have any issues or need any assistance, please use the chat function. And Aman or Maggie can help you with any back-end issues. We also encourage everyone to use the chat function. There is a drop-down bar there where you can select to communicate with either everyone, so please do. And or if you'd like to ask a question throughout, you can choose to communicate with just the hosts and the panelists. So feel free to add in the chat as we go questions or where you're calling in from today or any comments that you may have. We will be using polls throughout the webinar, so please watch out for those. I know there's one right off the top here, and we really welcome your participation in the webinar by completing the poll and contributing to the conversation and the information you'll hear today. There will be a 10-minute question period at the end. So as I mentioned, send those questions in throughout the webinar. We would happily like to talk about them and respond to them. So keep them coming, and we will have some designated time at the end for questions. The webinar is being recorded today. It will be posted on Core BC over the next few days, and also I know will be available through the BC Centre for Palliative Care. With that, I would like to introduce Kathy Shang this morning as we turn things over to the BC Centre for Palliative Care team. I've had the pleasure of working with Kathy for the last year and a half, 2 years on this project. As the project manager, she brings that enviable skill of organization, superb communication skills to this project, which I know you will enjoy hearing about today. Kathy's background is a clinical pharmacist as well as a master's in health administration, both from UBC. And why I've enjoyed working on this project with this team is Kathy's warmth, bright smile, her diplomacy, and ability to get things done all over Zoom. Very happy to have Kathy and her team join us today in their presentation. So over to you, Kathy.
Thank you so much, Angela, and thank you for the kind words. It was an absolute pleasure working with you as well. So hi, everyone. My name is Kathy Shane. I'm the project manager from the BC Centre for Palliative Care. So to start off, I'd like to share a little poll to get us started. So bear with me. I'm just going to launch the poll right now. You should see it pop up on your screen about now. And the question to get us started is, what is the most important part of advanced care planning? So to your knowledge and understanding of what it is, what do you think is the most important part? Is it making a representation agreement, choosing a substitute decision maker, making a most form, or having conversations about wishes for future care? So I will just give everyone a minute, a quick moment to select their answer. Okay, perfect. So I'm just going to end the poll right now and share the results. Let's see the results. Okay, so we see that the first choice is having conversations, and then it's about equally split between making a representation agreement and choosing a substitute decision maker. So I'm actually not going to share the correct answer right now because it is one of the key messages. The answer is one of the key messages we want to share with everyone as a part of this webinar. So throughout this webinar, you will see this little key symbol come up, labeled as key message. Keep an eye out for this, and the answer will be revealed in one of the slides. So today we will be sharing learnings from our project with the goal to engage people living with dementia and family friend caregivers in advanced care planning through community-led programs. And I'm here today with my two lovely co-presenters, Myrna and Michelle.
Hi, my name is Myrna Norman, and I'm a member of the Expert Task Group. And I'm also a person that was diagnosed with dementia about 12 years ago. I'm glad to be here.
Hi, everyone. My name is Michelle Met, and I'm the project coordinator.
So by the end of this webinar, you will be able to gain, first of all, an understanding of advanced care planning and BC Centre for Palliative Care's community-led education model. Second, you'll be able to gain knowledge of how the project has addressed barriers to advanced care planning engagement, and also gain awareness of resources developed for community organizations, people living with dementia, and family friend caregivers in BC. To start off, a little bit of background on the center. The BC Centre for Palliative Care is a provincial nonprofit organization funded by the Ministry of Health. Our mission is to accelerate the spread of innovations and best practices in palliative care to improve the quality of life for people affected by serious illness. So our work focuses around three core areas. The first one is to promote effective conversations and processes that help people get care consistent with their wishes. Second is to enable enhanced access to a palliative approach at all care settings. And third is to inspire and partner with communities to provide emotional, practical, and spiritual supports close to home. Now, one of the key enablers to receiving quality palliative care is advanced care planning, which will be the focus of our presentation today.
So you might be thinking, what is advanced care planning and why is it important? The BC Centre for Palliative Care defines advanced care planning as a process of thinking about your values, beliefs, and wishes, all for future health and personal care, and sharing them with the people that you trust. It can include choosing who would make care decisions for you if you could not. Advanced care planning helps you get the care that's right for you, even if you're unable to speak for yourself. So we have an activity here for you today. It's called a firework activity. It's a great way to get a large group involved, and this is how it works. So we're going to give you a question. We want you to think about it. And we want you to type it into the chat box here, but don't send it yet. We're all going to send it at the same time, and it's going to give us a little firework kind of feeling. So again, as Angela mentioned, just double check that your chat box is sent to everyone because we want to be able to see those answers coming in. So here we have the question for you. And again, wait to send it until I tell you to. So why do you think advanced care planning is important? In other words, what would your elevator pitch for advanced care planning be? So everyone take a few seconds to jot down what you think your answer would be for this question. And then we're all going to send it together. Okay, everyone, press send. All right, they're coming in here. So we have, Kathy might help me out here too, because they're all coming in at the same time.
Yeah, they're all coming in hot. Thank you everyone for participating. So we have from Melina, for your wishes to be known. From Jessica, to communicate your wishes about your own health decisions to your family and healthcare providers. from Kaylee or Callie, so that you can maintain your wishes even if you're not able to speak for yourself. From Lori, provide legal structure for wishes. From Cindy, we have, we want to have some say in our end of life, it's important someone knows and can speak on your behalf if needed. So here is just a sample of some of the wonderful answers that we received.
Excellent. Thank you everyone for participating. So we'll just go on to the next slide here. Here are some of the key messages about advanced care planning that we at the BC Centre for Palliative Care like to highlight. First, planning for future care is an important part of life planning. It's just as important as financial and estate planning. Advanced care planning is for all adults, not just people who are older or seriously ill. It's also a process that everyone should revisit throughout their lifetime. Second, there's always a possibility that our health can change in an instant. So the sooner we start the conversation and the process of advanced care planning, the better. Advanced care planning can help us get the care, help you get the care that's right for you during times of serious illness or injury, especially when you can't speak for yourself. Advanced care planning also benefits our family and our health care providers, as well as ourselves. It provides reassurance to you that your wishes are known. It's a gift for your family and friends. It provides reassurance to them that they know what you would want, especially during those stressful, anxiety-filled times if you were to get sick. It also helps reduce conflict as the family would know what your wishes are. It also helps your healthcare provider consider the treatment and care options that are consistent with your values, beliefs, and wishes.
So what is our community-led advanced care planning model? In 2016, a BC public survey commissioned by the Centre demonstrated relatively low levels of awareness and engagement in advanced care planning amongst British Columbians. Barriers identified included lack of information and resources, lack of time, and lack of time with healthcare providers. This data highlighted the need for provincially coordinated and community-led efforts to further enhance public awareness of advanced care planning. Working with two community partners who are already successfully hosting advanced care planning sessions in their communities, we collaborated on developing an education and engagement model known as the community-led advanced care planning model. The model at that time consisted of just one program, which is known as the peer-facilitated advanced care planning sessions. The model is designed to support community-based organizations deliver the peer-facilitated sessions within their communities. We provide training for staff and volunteers to become program facilitators, a comprehensive toolkit of resources for organizers, facilitators, and participants, as well as ongoing coaching and mentoring. Implementation and evaluations of the sessions show that they were sustainable and effective in increasing public engagement in advanced care planning. Furthermore, participating organizations experience more partnerships and connections with their communities, while the trained facilitators experience an increase in knowledge, skills, and confidence to conduct these sessions. So since the beginning, since 2016, we have continuously built on, evaluated, and improved the original program. From 2019 to 2020, the sessions were adapted for Chinese and Hindi cultural groups. Our project then further adapted this program for people living with early stages of dementia and their family caregivers. We also added a second program to this, which was a guided group conversation event. And the model was rebranded in 2020 as My Wishes, My Care community-led advanced care planning programs. So why do we adapt the model for people living with early stages of dementia and family friend caregivers? I'm going to pass it on to Myrna to share her story.
Hi, everyone. My name's Myrna. I didn't get the next slide, I'm sorry. I'm so glad to meet you all. I'm a person living with dementia, and I have lived experience. There we go. And I have lived experience. At the very beginning, shock and disbelief were with me when I was diagnosed with dementia. It was absolutely dreadful situation to be in. I had no idea what was going on. It was dreadful. We made several changes to our living arrangements. We sold our home, relocated closer to the grandchildren so that they would be around to help out. The first few years were difficult, to say the least. I've learned, though, that I have the right to be happy. I strive to be the best advocate that I can be for people living with dementia. Although my driver's license was removed by my doctor, and baking, cooking, bathing, and some other activities require assistance, I have opened, other doors have opened for me. I mean, I've written a book, I enjoy and write poetry, and I paint with acrylics. Who knew? I'm a person with expertise and have been asked to sit on a dozen committee boards and was even a keynote speaker at UBC in 2019. Wow, that was special. When my late husband died, the pain and grief was mixed with guilt because he had not been able in the years following that to discuss, or prior to that, to discuss any part of his disease, his future care, or his final wishes. I had no idea of the care he wanted, whether or not to do a DNR or any other discussions regarding his final and devastating loss to our family. Over the 5 years of this, there were countless hospital visits, lengthy stays for him, and then he was gone. With overwhelming feelings of loss, grief, anger, and guilt, decisions were made, but we all paid a heavy price. For this reason, I have done and will continue to advocate for and to continue to update my advanced care plan. There is a misconception that a person living with dementia cannot make decisions about their care after dementia has progressed. This is not true. People with dementia can prepare for their future health care and stay involved in the decision-making through advanced care planning, especially when they are supported by family and friends. Although advanced care planning can benefit everyone, regardless of age or health, it's especially important for people living with serious illnesses like heart disease, dementia, and kidney disease to begin the process as soon as we can. This is my life, and I want to be the decider in chief regarding my own welfare. Taking these decisions is not a macabre chore, but for me, it's a right of citizenship. I have the right to receive and help and support from the people I trust to make my decisions reality. Having my decisions honored and sharing my wishes with those I choose is a rite of passage. There have been many misleading suggestions about my abilities to make my own decisions. However, people living with dementia have the right to do this.
Thank you for sharing, Myrna. Thank you. So as Myrna mentioned, this is the main reason why we wanted to adapt our community-led advanced care planning model for people living with early stages of dementia, and also to help their family and friends support them through this process. So what we ended up doing with the My Wishes, My Care model is we had the two programs, the guided group conversation event and the advanced care planning information sessions. And the two programs were designed to be complementary and ideally be experienced sequentially. The guided group conversation event involves a facilitator leading a small group of participants through a set of questions aimed to encourage conversations about values, beliefs, and wishes for future care. So on this slide are a couple of the example questions from the event. And just as a quick activity, if you'd like to take a moment to consider these questions, jot them down privately, or you're welcome, if you're comfortable, to share them in the slide to everyone as well. And you can label your answer as 1, 2, or 3 in response to whichever question you want to answer. So the 3 questions we have here are, what is something that always makes you smile? Second one is, what activities or routines make your day enjoyable? And third is, what does quality of life mean to you? So everyone is welcome to take a moment and share your answers. So maybe I'm wondering, Myrna, what is something that always makes you smile?
Oh, goodness. Certainly the laughter of a child, my dog, and my flowers.
Those sounds like lovely things that would make anyone smile, but they sound like they would be very important to you. And Michelle, what are some activities or routines that make your day more enjoyable?
I love a good cup of coffee in the morning, just sitting there and taking in the smell. And I also love being out in nature. So those things I try to make part of my everyday, coffee and being outside.
Perfect. I'm seeing some questions coming in now from Esther. The answer to one is, engaging with others, and then walks outside listening to podcasts. That's one of my favorites as well, is an activity or routine that makes her day more enjoyable. And then the answer to number 3 was freedom to interact with others, take time for self, and to travel. We have from Lauren, answer to number 2 is having a purpose for the day, work, visiting with a friend. And then we have from Melina, answer to 2 is going on a walk through the trails on a hike. It's very Vancouverite and British Columbian thing to do, definitely. So these are some great answers. As you can see, the goal of this event with these questions is to get people to start reflecting about what makes their life worth living and what does quality of life mean to them. The focus is not actually on end of life and what a good death is. And the hope is that by getting them to think about it, they will start delving into what are some of their values, beliefs, and wishes they have for future care. And if they are attending with family members and friends, they can begin to learn about what each other's wishes are for their future healthcare or personal care. So the second program is the Advanced Care Planning Information Sessions. So the information sessions are an interactive 2-part series that shares the steps to advanced care planning and resources to help participants get started. So pictured here are some of the slides that we provide program facilitators with. One part of the sessions is to inform participants of their healthcare decision-making rights according to the law. The curriculum of the information sessions is also based on BC Centre for Palliative Care's simple 3-step process for advanced care planning: think, talk, and plan. So think refers to thinking about what matters most to you, your values, beliefs, and wishes for future care, and also thinking about who can make health and personal care decisions for you if you cannot. And this is in reference to substitute decision makers. Talk means discussing what you thought about with your family and friends, and also with your healthcare providers. And then plan refers to creating an advanced care plan, which includes making a record of your wishes and also sharing your plan with the people you trust, as well as your healthcare providers. Both programs emphasize that really the most important step is the conversation and the talk step, and sharing your wishes for future care with family, friends, and healthcare providers. And this is so that they would know what you would want if you can't speak for yourself, or who they should be asking to speak for you if you're too ill or injured to do so. So now I will briefly review how the programs were developed. The project began in January of 2020, where we conducted an environmental scan and interviews with community organizations and people with lived experience to identify barriers to advanced care planning. We went through an adaptation phase to develop the programs based on the environmental scan learnings. We then piloted the programs and then implemented the programs and are now in the final spread phase. In fall, winter of this year, we will be releasing the finalized programs and toolkit of resources. Throughout this process, the project team worked closely with an expert task group and an advisory committee. Program adaptation and improvement was completed using quality improvement cycles of adaptation, program implementation, and evaluation. Following BC Centre for Palliative Care's guiding principles, the programs were first of all informed by evidence through our initial environmental scan, literature review, focus group consultations and interviews with with people with lived experience, and also from collecting evaluation data through our pilot and implementation. We've also engaged people with lived experience throughout this process and across multiple levels of public engagement, both as decision makers on our advisory committee and expert task group, and also to provide feedback and consultations through our focus groups. Third, our public engagement efforts as a result has ensured that our materials are both person as well as family centered. We had to respond to emergent needs as a result of the COVID pandemic by tailoring the programs for in-person and also online or phone delivery platforms. And last but not least, partnerships were really key to the success of this project and will continue to be a very important part of the community-led model. So whether it be through consultations with our project partners, such as United Way, Alzheimer's Society of BC, and Family Caregivers of BC on our advisory committee, or through our partnership with community organizations that allowed us to evaluate the programs and also to implement this model to begin with.
So in total, we partnered with 4 community organizations to pilot the programs and then 10 sites to implement them on a broader scale. Through this process, we trained 47 staff and volunteers to become advanced care planning facilitators, who then went on to host 20 guided conversation events and 15 advanced care planning information series. Our pilot and implementation community partners were located all across the province. We have multiple organizations in the Lower Mainland, one in Vancouver, Sunshine Coast, the Kootenays, Interior BC, and one in Northern BC. For the final spread phase of the project, we'll be partnering with more community organizations to offer the finalized program across British Columbia. As of right now, we have 23 spread sites located in Northern BC, Interior BC, Sunshine Coast, Vancouver Island, the Gulf Island, and Lower Mainland. So in total, we have 10 rural remote sites and 13 urban city centers. These 23 sites cover a wide range of community-based organizations, serving a diverse population across BC, some of which include we've got 5 community health and wellness organizations. We've got Family Caregivers of BC, CareRx, which is a community pharmacy, St. John Anglican Church, L'Chaim Adult Day Center for culturally Jewish adults. We have 8 hospice societies and 2 end-of-life doula organizations, as well as the Ismaili Health Board network of volunteer healthcare providers. So we got a really wide range, which is great. So next we'll talk about the interim evaluation results. To evaluate the 2 programs, our evaluation team used a mixed method approach. These include surveys and interviews completed with both the facilitators and the organizers. The interviews with members of the project advisory committee just to get everyone's feedback. We also did public participants and they completed the surveys after each program, as well as a follow-up which would include online survey or phone call 3 to 4 weeks after the program to see how the information has set in over time. On this slide here, we have charts indicating the effectiveness of the facilitator training for the conversation event. You'll see here in the first chart is the response to the statement, "I have the knowledge needed to facilitate a conversation event for the public." The green represents individuals' responses after the training and the yellow is before. In the second chart, you'll see this is the feedback regarding needed skills to facilitate a conversation session. Again, using the same color scheme. And as you can see, there's a big difference before and after the training, in that facilitators felt they had the knowledge and skill after the training session. Here we have another chart, again with the same layout, looking at the effectiveness of the advanced care planning information sessions. So again, looking at the skill level before and after the training. And once again, we see a big difference before and after, showing that the participants received valuable information to help them run these sessions. Here we have some feedback from the participants. So the first one here says, these two particular workshops really helped clarify my values, wishes, and beliefs and assisted in updating them. We've got another one that says, it was very helpful to share my answers to the questions and hear the answers of other participants. And the final one here on this slide says, of the two workshops, I like the tone of the conversation event best. The sense of doing this together was maintained throughout. So we really got some great positive feedback. Here we have some feedback from facilitators and organizers. The conversation event was effective because the participants in the information sessions referred to the questions in the conversation event, and it really set the stage for advanced care planning information sessions and the bigger picture. The event really helped people discover and know what their values are. Some more feedback that we received was, I specifically found the examples and stories about advanced care planning excellent in getting the point across that advanced care planning is life planning and will change and evolve as we age and as situations change. And the final quote here is, the facilitator training was well planned and organized. The team did a great job in terms of sharing the information and the model. So there, that shows that we received some great feedback from our organizations and facilitators, which is great. Here are some of the results that the pilot showed us. So we have 95% of respondents agreed that the conversation event helped them think and talk about their values and beliefs and wishes for future health and personal care. We had 91% of respondents agree that the information session helped them understand the steps of advanced care planning, including how to choose a substitute decision maker and how to prepare an advanced care plan, which is great. When we followed up with participants 4 weeks after they attended the programs, 89% reported that they thought more about their values, beliefs, and wishes for future care. 77% of respondents talked with family and friends about their values, beliefs, and wishes, which is great. We have evaluation results from the implementation phase are currently being analyzed, and they'll be available in the fall. So we have more info to come on that.
Great, thank you, Michelle. So as she mentioned, we're currently still gathering all of the implementation data and analyzing it to see how else we can improve the programs or toolkit. However, I'd like to share ahead of time an unexpected highlight from our implementation phase this summer was actually the successful delivery of the programs at a remote First Nations community in northern BC. So a facilitator from Terrace Hospice Society had the unique experience of conducting the programs in person with 25 Gitwangak First Nations elders. She did so by organizing an elders luncheon with staff from the local health center. And she also conducted the programs at Gitwangak, which is the local non-First Nations community. So what she said worked really well with the First Nations elders was, first of all, the stories that we wove into the curriculum to use as examples. The elders expressed appreciation for oral storytelling, which they found to be engaging and relatable. Conducting the series of events and sessions, which I mean by one conversation event and the two-part information sessions, also really helped her as a non-First Nations facilitator build comfort and trust with the elders. Third, focusing on advanced care planning and living well rather than the prognosis of dementia or end of life and dying helped manage stigma around dementia and death in the First Nations community. Technology was also a huge barrier, so the facilitator actually went above and beyond and created her own hand-drawn flip charts from our presentation slides to complement the information sessions. And an example is pictured here on the right. And finally, providing opportunities for one-on-one support and conversations was really important for the First Nations elders. The elders were much more private and hesitant about sharing their answers in a group setting during the conversation event, especially, and compared to non-First Nation participants. However, many of them did end up coming up to the facilitator one-on-one after the fact to share their stories, their answers, their experiences, and also share their appreciation for both programs. So before we move on to the next session and share some learnings from the project, we have our next and final fireworks activity. So consider this question. So in your private life, or even in your at work, if you're supporting someone else with advanced care planning, what are some barriers to advanced care planning that you have encountered? So everyone take a minute to think about it, type it out, but wait to hit send. And remember to select to send your message to everyone in the chat box. So I'll give everyone a couple minutes to think about this. So what are some barriers to advanced care planning that you have encountered, whether it be your personal life or professional life? Okay, and go ahead and click send. Perfect, thanks everyone. So I see we have lots of answers coming in. So, I mean, we've also learned from the project that unfortunately, as of right now, there's still quite a few barriers that prevent people from engaging or even being interested in the topic. And many of you have listed them here. So Kaylee or Callie mentioned the amount of information needed seems overwhelming. Myrna said not wanting to share due to fear. Jessica said not having the information, waiting too long to communicate wishes. Lauren said remembering that your loved one's wishes may be different from your own. That's a really great point, especially from the perspective of a family, friend, caregiver. And Esther mentioned assumptions, language. Cindy says participants struggling with estranged relationships, so family dynamics. Thank you everyone for participating. These are all really great and common barriers. I don't want to say great, but these are definitely common barriers that we have encountered through this project. So what I will do now is actually pass it on to Myrna and Michelle to talk about the barriers that we've encountered, which many of you have mentioned in the chat already, and how we have addressed them as a part of this project.
A lack of awareness and knowledge of advanced care planning is a main shared barrier for people living with dementia and their family caregivers. Providing a concrete step-by-step approach can help minimize this barrier. The programs were designed to ease participants into the topic of advanced care planning first through conversation events and then the information sessions. The process of advanced care planning is also presented in 3 steps: think, talk, and plan. To address a lack of engagement in advanced care planning, emphasizing conversations rather than legal forms has been found to be the most effective way to engage people living with dementia. It is also a most accessible way to do advanced care planning for people. The interactive nature of both programs aims to model comfort in having these conversations. Storytelling is also an effective way to increase engagement. The conversation event in itself is an opportunity for individuals to safely share their stories. In the information series, stories, videos, and letters are woven through the curriculum to complement the information shared. Stories work particularly well with the Gitwangak First Nations. Finally, as demonstrated by the Terrace Hospice Society, the programs need to be tailored to the needs of that particular community. Offering structure with flexibility is the key strength of community-led advanced care planning model. Difficulty with conversations about healthcare wishes is another common barrier. The conversation event was developed to normalize conversations about healthcare wishes, personal wishes, and end of life in a safe, inclusive environment. The information sessions provided helpful tips and conversation starters. And these were the things that you spoke about in that last chat. To address stigma around dementia, death and dying, the focus of the programs is on living well with dementia and the benefits of advanced care planning, rather than the progression of dementia or end of life. In fact, it's a common misconception that advanced care planning is only about preparing for a good death. Advanced care planning is about living well and helping people express what quality of life means to them, regardless of their diagnoses. To address the lack of supports for people living with dementia, all participants are given materials and resources to support every step of the advanced care planning process, including creating an advanced care plan and completing legal forms. Partnering with community organizations and dividing the information series into a two-part series ensures that there can be continuity in the support that participants are receiving. To address the concerns that their wishes and instructions may not be honored, both programs emphasize the decision-making role of the person with dementia and the supportive role of the family members and friends. The conversation event encourages participants attending as pairs to speak from their own perspectives and not for each other, and that's vital. The information sessions emphasize the role of substitute decision makers as advocates for the person's wishes. To help family and friend caregivers understand that the person living with dementia is capable of being involved in their decisions about their care, we developed a guide for substitute decision makers to help understand and prepare for their role. The guide emphasizes the importance of supported decision-making as dementia progresses. To help with feelings of overwhelm, the programs were designed to be deliverable in person and online. The conversation event can be delivered via conference call. Caregivers expressed appreciation for the online option as they enjoyed the flexibility of being able to attend from the comfort of their own homes.
The barrier for organization was limited resources and time. Once again, our structured yet flexible curriculum helps to address this. We provide organizations with all the training, tools, and resources they need to host both programs, and they can tailor each curriculum to their needs and capacity. So for example, organizations with limited resources can choose to only host the conversation event. Then they can direct the participants to our resources to learn more about the steps of advanced care planning. Recruiting for participants, especially people living with dementia, was also a challenge for some organizations. Organizations that had existing connections with people living with dementia were the most successful. Targeted recruitment and reaching out to individuals or families was also done and was more effective than public recruitment through social media. We learned that special attention should be paid to terminology use in the marketing materials. So in the pilot, we promoted the programs as events for people living with early stages of dementia. And this terminology was a barrier, especially in small rural communities where people didn't wish to publicly identify themselves as a person living with dementia. So because of this, we adjusted the terminology to people experiencing memory loss and early symptoms of dementia. And we saw that this was much more successful in increasing engagement. So due to the pandemic, most of our partner organizations had to host the programs virtually. So conducting the programs in small groups with families or with individuals on a one-to-one manner really helped to minimize those technological barriers for both the facilitators and the participants. One great example is CareRx, a community pharmacy in Vancouver, worked with staff at an assisted living residence to attend an in-person session with the help of staff, and the CareRx facilitators were able to deliver it online, but the residents had that help from the staff members. So this is the first time the center had partnered with a community pharmacy, and this method of program delivery really helped us reach individuals who were quite isolated from their communities due to COVID-19. So that was a really great way of how we were flexible with our programming, and it turned out great.
Okay, so by now you've heard a lot of talk about this toolkit of resources we'll be releasing at the end of this year. And now I will provide an overview of what they are. So for its final release, the My Wishes, My Care programs and resources will be geared for older adults people living with early stages of dementia and their family and friends. What we've learned from the project is that, especially in the early stages of dementia, there encompasses a wide range of individuals with differing symptoms, some of whom have received a formal diagnosis of dementia and many of whom who have not. Receiving a delayed diagnosis is actually quite common with dementia. So with age being a predominant risk factor for dementia, we're hoping that including older adults will help engage people as early on in their illness trajectory as possible so that they can get started on planning as soon as possible and they have the widest variety of legal tools and forms available to them. So in terms of resources for organizations in this toolkit, we have the suite of resources listed here. To start off, we have, of course, our facilitator training. And then after they've attended training, they receive all of these resources. So they receive a program overview, community partner guide, which is essentially a program planning guide, facilitator guides, one for each program that essentially walks the user from the beginning to the very end of conducting both programs. They also receive presentation slides with scripts that they're welcome to adjust and make their own to go with each program, marketing poster templates, evaluation surveys to help them continuously collect and evaluation data on the programs and also improve on their delivery. And finally, public participant resources that they can hand to the participants after they've attended both programs, one or both programs. So when I'm talking about the public participant resources, this is what I'm referring to. So what we've included in the toolkit is a resource to support each step of the think, talk, plan process. So an overview of the process is the Advanced Care Planning Information Booklet. To support think and plan, we have what is called Thinking It Through. To support talk, we have Starting the Conversation. And the plan part, we have what you need to know about making standard representation agreements or the Section 7 representation agreement. And as you can see in the red asterisk, it indicates that these resources were reviewed for legal accuracy by Canadian Centre for Elder Law. So the Advanced Care Planning Information Booklet I mentioned essentially walks the user from beginning to end step-by-step process of how to do advanced care plan, how to do advanced care planning and how to make an advanced care plan. Thinking It Through, which supports the think and plan steps, is a resource that was a collaborative effort between BC Centre for Palliative Care, various projects, as well as virtual hospice. So this booklet contains questions to help people think about and record their values, beliefs, and wishes for future care. So like I mentioned, not only does it support the think step, it can also serve as a record of wishes, which is an essential component of an advanced care plan. Starting the conversation is the list of questions with additional questions as well that are used in the conversation event. So participants after the fact are able to take this worksheet home where they have their answers filled in. They can also print out fresh ones to try out with their family and friends as conversation starters. And we will be sharing this as an independent resource as well on our website. And last but not least, we are very lucky in BC that we have the Section 7 representation agreement available to us, which allows people who have some cognitive challenges appoint a representative. So this guide that we're developing helps the reader understand what the standard representation agreement is and how to make one. So the primary resource we've developed for family and friends is known as You've Been Asked to Be a Substitute Decision Maker, Now What? So this guide helps substitute decision makers understand their role, responsibilities, and what their rights are according to the law. We have also included step-by-step instructions on how they should prepare their role, and there's an emphasis on the importance of supported decision-making versus substitute decision-making and the presumption of capability. So I'd really like to highlight this resource because I think it's a very unique little guide that we've developed for British Columbians. And last but not least, going along with all of our resources that we've developed for this project, the BC Centre also has another suite of resources to support advanced care planning. So you can visit our website at bc-cpc.ca/ACP. And our sister project, the Culture Adaptations Project, actually went and translated all of our web pages from English to Chinese and also to Punjabi. And in addition to that, they've developed a guide to help people make the enhanced representation agreement, or the Section 9 agreement, which has been translated to various languages. And that representation agreement can be made by people who are fully capable of decision-making and understanding information. So I've given everyone all of this information. We've shared what we've learned. Now what? So I first like to highlight the results from the most recent 2021 national poll conducted by Advanced Care Planning in Canada. And what they found was that between 2019 and 2020, the number of Canadians who talked to a family member almost doubled, from 1 in 3 to almost 2 in 3. So what this poll confirmed was that more Canadians are taking action and are more comfortable with having these conversations around advanced care planning and end-of-life care. However, what they found was that the main barriers still seem to be lack of information or resources. Canadians said that they couldn't find resources, they couldn't find anyone to help them with the process or even point them in the right direction. So as representatives, volunteers, and staff from community organization, you are really on the ground and you have your ear to the ground. You understand your communities the best, and you can help to meet this gap in the lack of information and resources. So how you can get involved in our activities is, first of all, either become a community partner as a part of our community-led advanced care planning model. Unfortunately, our last round of October training sessions this year are already full. However, we do conduct more training every single year, so keep your eyes peeled for further announcements. And second is, of course, to share our resources. And like I said, they will be available in November. We're also working on updating our entire online resource hub that contains all of our other resources as well. So they will all be packaged and available to you in November of this year to share with the people that you're supporting, your clients, etc., or even your own family members and friends. So if you're interested, please do subscribe to BC Centre for Palliative Care's newsletter for updates, and our newsletter is known as Centerpoint. And I think, Michelle, if you haven't done so already, if you could just share the link here, and we'll also post it with the recording. So now that we're reaching kind of the end of the presentation, I'd just like us to revisit this poll again. So this is the first poll that we started with, and I'm going to let's see if I can relaunch it. Okay, so I've just relaunched the poll question, and feel free to go ahead and take a stab at this. So now that you attended this webinar, what do you think is the most important part of advanced care planning? I'll give everyone a moment. Okay, so I am going to end the poll now and share the results. So the results is looking a little bit different now. I see over 90%, everyone chose the conversations, and then we have one choice for the representation agreement. So for those of you who chose conversations, that is definitely correct. Representation agreements and documentation is an important part of advanced care planning, but it's definitely not the most important part. And this is because with advanced care planning and healthcare decisions, a lot of times they are made during emergencies, and they are snap decisions that are made. So often, healthcare providers, even family caregivers, they don't have time to go through documents to even find out who is your representation. What they would do is just talk to your family or talk to your friends and ask them questions right away. So this is why having conversations and sharing your wishes is still the most important part of advanced care planning. And this also includes sharing with everyone around you, who do you want to make your healthcare decision? So who your temporary substitute decision makers are, who your representation or who your representative is if you made a representation agreement. So a representation agreement is an important part, but definitely not the most important part of advanced care planning. Okay, so thank you everyone for participating. So just to wrap up our portion of the presentation, we'd just like to thank our funders, Public Health Agency of Canada. Also thank our project partners, especially United Way, for providing this platform or organizing this webinar for us, our expert task group members, advisory committee members, and focus group members. Here are our contact information, which, like I mentioned, we'll also provide as a part of the recording. And I will pass it back to Angela to wrap us up.
Thank you, Kathy. Wow, so much great information. I want to say, first of all, thank you to all of you on the line for your participation. I love the interactiveness of the fireworks, the polls, and the chat box. So thank you for your participation. A special shout out and thank you to Myrna, Michelle, and Kathy for all of that great information and a wonderful webinar. We do have about 5 minutes left where we would be happy to answer any questions that you may have. So please, on the bottom of your screen, you should see a Q&A pop-up bubble. Feel free to drop any questions you may have in there, and we will take 5 minutes to answer those questions. While you do that, I just want to draw your attention to the slide that you saw on the board. If you don't mind just going back one, Kathy, thanks. As we mentioned at the top of the webinar, these slides and recording will be posted on our core website, as well as BC Centre for Palliative Care's website. And this slide just gives you a little bit of information about how you will be able to find the webinar and or any previous webinars that have been presented on core. If you're not a member of CORE and this is not a familiar place for you, then certainly maybe I'll ask Maggie to drop it into the chat box, the link to CORE, and please sign up for CORE. It is chock-a-block full of resources, a great spot for anything community-based to be found. So I do have one question, Kathy, that has been submitted, but feel free. We do have a few minutes left to drop any questions into the chat box, the question box, if you have any. Kathy, the one question that has come in is who will be able to access the toolkit come the fall?
Yeah, that's a really great question. So for the toolkit of resources for organizations, so that will be accessible. So that will be password protected and will be only accessible by organizers or organizations who have partnered with us and who have received the facilitator training. So like I mentioned, our October round of training sessions are full, unfortunately, but we do host new training sessions every single year, if not multiple times a year. So stay tuned. However, all the public facing resources, so the Thinking It Through, just trying to flip to that. The Thinking It Through, you've been asked to be a substitute decision maker. All of these will be available on our website. And like I mentioned, we are working on updating our online hub of advanced care planning resources, so bc-cpc.ca/ACP. So in November, we'll let everyone know also when that's available to go. But you can definitely visit our website right now and see the resources that we have on there. Our dementia project related resources have not been uploaded on there yet.
Okay, thank you. I've had one other question come in that I'd love to pose before we wrap things, but feel free. We probably have time for one more if anyone had a last one that they would like to ask us. Myrna, this question is for you. As a person living with dementia, I was particularly engaged by your story. And the question coming in is, what would your advice be to someone as, where do you start? Where do you start in what's often an uncomfortable conversation, or people have trepidation, a fear, family dynamics? Where do you start to have that conversation as a starting place?
So I can just give you what happened with me and my family. When I was diagnosed, my doctor said, go home and get your affairs in order. And so we did immediately that. We went home, we consulted a lawyer, we set up an appointment for the whole family, and we did it. Now things are so much better. I think COVID has really helped to open the doors, and people are actually talking about what they want, being that things are so changed. I can see that the thinking about it and then opening the door to conversation is the most difficult part. And you know what? It's just like, just do it for your own sake. Just do it.
Thanks, Myrna. I think that's a great place for us to wrap this session. I really want to thank the three of you for your presentation. I would like to thank all of you on the line for your participation and engagement and all of the work that you do supporting older adults in our communities around British Columbia. I love the way that you flip this on its head and we're looking at things in a way of living well, having positive conversations, and getting it done, just getting it started, as you say, Myrna. So thank you all very much for your participation. Please circle back and follow up with the great resources that are ahead and available from this project, and have a great rest of your day. Thank you very much, everyone.